we now have the last session of this morning, and our speakers from OpenHIE, or Health Information Exchange, a community of people building an open framework to support nations as they develop health information exchanges to improve patient care, public health, and the management of health resources. And now the OpenHIE organizes an academy, and AHIN actually has 9 countries with 26 members to learn more about HIE and implement this in their own countries. So we have 2 speakers. We have Jennifer Shivers, the integration architect and senior business analyst of the OpenHIE Academy, and Jamie Thomas, also the community manager of OpenHIE. Good morning, ladies. Thank you for joining us.
Yes, good morning. Thank you for having us.
Good morning. Nice to see you all.
All right. Well, I just want to again say OpenHIE has had a very proud partnership with AHIN, and we want to thank you guys for having us today. My colleague Jennifer and I are going to give a brief overview of what OpenHIE is, what our community goals are, and the conceptual architecture, and some resources and ways to get involved. Go back here. So OpenHIE's mission, for those who may not know, is to improve the global health equity through the open collaborative development and support of country-driven large-scale health information sharing architectures. But it's not something that can be done by one single group of people or organization. OpenHIE is a community of practice. It is not something you can download. OpenHIE provides a knowledge space for peer learning, knowledge sharing, and collaboration. And for those, I'm sure many are familiar with communities of practice, but for those who this may be a new idea, communities of practice, let me share a little bit about communities of practice that have been around for a while. So communities of practice seek to optimize how people can work together, right? They're a way for people to engage in a process of collective learning and peer support, around a shared interest. They're meant to be low cost and high impact way to move pre-existing efforts forward. In OpenHIE, our shared interest is advancing enterprise health information exchange with emerging economies. So OpenHIE started out, and I'll give this kind of origin story that we have for our community. In 2009, a consortium of organizations and individuals came together to collaborate on an idea around health information exchange in Rwanda. In 2012, a summit was hosted in Rwanda. It was sponsored by the US President's Emergency Plan for AIDS Relief, or PEPFAR, and hosted by the Rwandan Ministry of Health and Gembi Health Systems. It brought together key subject matter experts, open source health software organizations who contributed to the refinement and extension of the architectural work happening in Rwanda, which formed OpenHIE's first conceptual architecture. And in 2013, OpenHIE formalized and launched the community of practice that you know today. We've gone through different phases. We've built consensus around mission and vision and objectives. We've done support planning and adoption. And we've built awareness and support implementations. But this is all different areas in which we are continuously learning and adapting together as a community. In 2018, we held our first face-to-face meeting in Tanzania to showcase the strategy, approach, and components that empower standards-based sharing of health information exchange to improve health outcomes. And in 2019, we held our second face-to-face meeting in Ethiopia and built awareness around OpenHIE, beginning to better understand where and how architecture is being used by countries and learn how the community could help to support local implementation. Over the last few years and during the pandemic, OpenHIE has been working to become a place where countries can share and build rapport with each other and find support from subject matter experts. And I'm happy to be able to say that in 2023, we'll be able to have a face-to-face meeting again in Malawi. We'll be hosting OpenHIE's next meeting, and details will be coming out soon, so stay tuned for those. So OpenHIE, as I said earlier, was formed around a conceptual architecture, which you can see here in this slide. Again, you cannot download it, but this is a reusable framework for the way health information data is shared between health systems. OpenHIE community members have come together around the shared interest of HIE architecture, but it is not the heart of our community. People make the community. People make OpenHIE what it is. We have a diverse community providing peer support at all levels. So ministries of health and governing bodies, implementers, funders, domain and technical experts, developers, end users, standards development orgs. I could probably go on for a little bit of all the different types of people that make up our community. Everyone who participates, though, has everyone who participates has the shared interest and the same desire to walk alongside projects to help support the real world needs, not perceived needs. And at OpenHIE's core, members want to understand what the community can do to better support countries. So this slide shows you some practice areas and sub-communities that are under OpenHIE or part of OpenHIE. All of these communities encourage openness and collaboration when it comes to sharing knowledge. Again, these are all open and people join to engage in conversations around different components and elements of HIE. Most sub-communities have a leader or facilitators who organize meetings as needed or desired by the community. And there's a link there where you can learn more about the different sub-communities of practice areas and how you can engage with those. And I wanted to share this slide because as a community of practice, we believe best practices should be shared, not locked away. And so these are the guiding principles that are at the foundation of our community and the people that make up our community. And so next, I will turn the microphone over to Jennifer, who will share more about what OpenHIE has to offer and some of our resources. Jennifer?
Yeah, thank you. So this slide really talks about how even though we have resources, we are using what we do together to create these resources. And Jamie's talked a little bit about some of those community building resources, which would be those sub-communities or conversations. I'm going to talk a little bit about standards and then a couple of the other community offerings. When we think about standards, a lot of times we think about HL7, FHIR, and IHE profiles. OpenHIE works with these organizations to ensure that as we think about how data moves between the different components of the architecture, that there are standards in place. And Jamie, if you want to go to the next slide, some of the ways that we help implementers are with these two documents. I'll start with the architecture specification, which is on the right. The architecture specification really does three things. Number one, it outlines what are components or what do we think some of the technical pieces are that are needed for health information exchange. So that goes back to that diagram that Jamie shared. The second thing that the specification does is it really outlines what are the functions of these components. For example, the specification outlines if you're going to be choosing a client registry or a facility registry, what are the functions that that software should be able to support at a high level, and outlines that. And the third thing that the specification does is it really begins to point to then those data exchanges between components. For example, what might be the FHIR implementation guides that are available for doing particular data sharing, or what might be the IHE profiles that should be used for sharing data between components. And that way we're directing you into how those pieces of the architecture can function together and help you identify the standards that should be recommended or applied in those types of use cases. Again, we base these documents and the Getting Started guide, which is really about like, what would you do to get started with one component in the architecture? Or what would you do to get started with outlining your architecture? We base these documents upon the real world experience that we're hearing from you all as you present back to and share with us. And so it's really important if you find that a data exchange that you're needing is not outlined in the architecture specification, by all means, please share that with us and we will work with the appropriate standards organizations to see if there already is a standard and then get it documented. And if there isn't one, we will work with those organizations to create one. So these are two things that you can use as you're thinking about implementation. The next slide really talks about some of the things that we have for capacity building. We have an Academy website, and AHEN has really had a focus over the past few months about getting certain people certified in OpenHIE. All of our materials to understand the basics of health information exchange are free and open to anyone, but there is a small fee for a test to become certified as someone who understands the basics of health information exchange. And so that opportunity is offered by the Academy. The Academy is also a living part of OpenHIE, and on the next slide, I'll talk just a little bit about some of the new opportunities for learning that we're seeing emerge in the Academy. One of them is around terminology. We know that this is a place where we see community members beginning to focus. And we also know that this is a bit challenging because it's not as, in some ways, not as easily to understand as like a facility registry, for example. So what we're trying to do is put together like a learning pathway that would help you on this journey. So we've got some HIE or Health Information Exchange foundational courses that many of you may have already taken. And then to build on top of that, we have some terminology specific courses that are available. In addition, we also have connections to courses like Understanding LOINC and a LOINC overview that's available in the Academy. Besides terminology, we've also recently launched some materials on identity management and client registries. So you'll see that out there. And again, we would love this to be a partnership. So if you see materials or gaps that you would like us to fill, please let us know, and we will be glad to partner with the community to make that happen. Next slide, I think over to you, Jamie.
Yeah, thanks for that, Jennifer. So just lastly, I wanted to share with people just ways of engaging or following and participating with OpenHIE. So some ways to stay connected. We've got Twitter, we've got a mailing list. We try to stay sharing a lot of information and announcements out there. We are looking to continue to expand our YouTube in the coming year. And then we also have a discourse forum where people can ask questions, have conversations with each other, and just connect. As well, we have a WhatsApp group where people can go out and ask questions in real time, of course. I'm sure many of you are familiar with WhatsApp, but really just a place in which people can ask questions, share things that they're doing, successes, challenges, but really just to bring the community together. So wanted to share that with people as well. So I will take this opportunity just to once again thank you guys for having us today. We really appreciate it, and I will turn back over to you all. Thank you.
So a round of applause from for our friends at OpenHIE. Maybe there are a few questions. Alvin will read them for you. And we also invite the audience to please come up to the mic so that we can facilitate this discussion. Yes, Alvin, you first.
Jen,
Then,
Jamie, thank you for staying up late for us over there. One quick question. There was an earlier session on total cost of ownership from Tara. and now you're talking about an OpenHIE interoperability framework. And we were wondering if, and one of my questions then was like, is there a taxonomy for total cost of ownership? And I'm seeing that your artifacts, your architecture, and if you attach a price to an architecture or an artifact, might help countries with their total cost of ownership. So wondering if later on we can have a cross pollination of Tara's work and your work and come up with a unified TCO set of artifacts. Just an idea. Good to see you.
Yeah, Alvin, thank you for that idea. We'd be glad to participate in a conversation about that. Thanks so much for considering that.
Thank you. Good night.
We have our friends from Sri Lanka. Yes. Please share your name too, sir.
I hope can you hear me? Yeah. So I'm Dr. Pramod from Sri Lanka. So actually really happy to participate in this conference, and the related the things in OpenHIE. So we are currently in position of developing fire standards and IG and country profiles. We almost created a few more profiles related to in relation of developing of the registries. So the we are in a position of developing registries, mainly provider registry, client registry, and institutional registry. And I am also interested. And our next plan is the terminology. So, do you have any experiences or previous experiences regarding the terminology services development related to the OpenHIE? We are happy to share the information.
Yeah, Jamie, I'm happy to jump in on this one. We do actually have a terminology community. In addition to that, I did share that there's some specific things that we have been putting some of the learning that we've seen happening in the community into those courses that I mentioned about terminology. I don't think either Jamie or I are actually the terminology experts on our team, but if you wanted to send us a quick email, we could definitely get you in contact with Joe and John and Jack, who lead that community. And they are working with Ethiopia and some other countries on getting started and how to move forward with terminology. And I believe there was a recent community meeting where some of that experience was being shared as well. So we can definitely send you some resources if you reach out to us. Jamie, I don't know if you have anything to add.
No, I'd love to make those connection points. So yeah, I'd love for you to reach out. My email is jamie@ohio.org. So at any time, please feel free to do so.
Thank you very much. I will reach out. Okay.
More questions from the audience at this point, Alvin and Jai? Anything in the chat box, or Christine? Okay. So with that, thank you very much, Jennifer and Jamie from OpenHIE, and we'll hear from you again. Thank you.
Thank you.
Yes, we're excited because OpenHIE has been with AHIN for the last 10 years then. Okay, thank you again.